Hello, everybody. My name is Tony. I am here with this direction, Jonathan. Uh, we are going to talk about personality disorders tonight. It's right, like, if Jonathan does this, you'll see right there. It's pointed. That's what we're talking about. Right there. So that's what we're talking about tonight. You know me, maybe. I am the outreach coordinator at AMI-Quebec, but you probably don't know who Jonathan is. So, Jonathan, who are you?
Hi everybody. I'm happy to be here. I'm Jonathan. I'm a psychiatry resident at McGill University. So that's
Perfect.
it.
Yeah, yeah. So every time I start these things, I always start with a weird question. So today's question is going to be, if you could take the power of any animal in the world, what would it be and why? So like either their physical power, like characteristic, or whatever.
Hmm. It's
This
interesting.
is a hard one.
Yeah,
I've never done this one
the
before.
hardest. That's probably the hardest question I'll get tonight. I don't know. Probably something like a bird. Like having the power to fly seems very cool.
Yeah,
Just being able to see the world like uh,
from like high up.
from a
Yeah.
different perspective. Yeah, probably.
Yeah, that's a good one. It's funny because every time I do this, I always pick an animal, and I say pick an animal or whatever, and I always pick flying squirrel for that kind of like that gliding and thing. But
Yeah.
I think for this time, I think I'd like to do. I'd like to be able to hold my breath like whales. That's what I think I'd like to do, because then I could like go underwater for like hours at a time, and I think that would be pretty awesome. So that's our start. So now that we've done that, we can talk about personality disorders. Just so everyone who is tuning in, if you've never tuned in and don't know how this works, we're going to talk about personality disorders. I have a bunch of questions that I'm going to ask Jonathan. He's going to answer them as best as he can. And if you have questions, you can ask them in the comments, and we will try to address them as best as we can as well. And something to keep in mind is that anything that Jonathan says is not to be taken as medical advice. If you have medical questions, please see your doctor. We are just two people who are answering questions on the internet tonight. Some may be more knowledgeable than others, and don't take it as medical advice. He's not your doctor. So that's just the caveat in the beginning. Yeah. So let's talk about personality disorders. If you had to sum up personality disorders in like the 15-second elevator pitch, right? Like someone's like, what in the world is even a personality disorder? Like, how is it different from anything else or other disorders? How would you like sum it up? I don't know the answer to this question. So this is like, yeah,
So first, there are many personality disorders, but
yeah,
overall, what is a personality disorder? It's, I would say, a rigid pattern of difficulties that someone may have.
okay,
And it can be cognitive, affective. They
yeah,
struggle with their emotions. It can be relational.
okay,
But basically, it's a rigid pattern of person being that make them struggle in life and having difficulty functioning as other human beings.
okay. All right, so it's a pattern or a rigidity. Okay, this all makes sense. So I know that. Let me. There we go. I'm just sorry. I'm answering questions, putting questions in the comments here now too. So yeah, again, if anyone has any questions, feel free to ask them in the comments, and we'll try to get to them. So I know that personality disorders are grouped into clusters. This is part of my homework to be prepared for this, was doing this and finding this out. And so this isn't necessarily that someone else knows. So let's just start with the basic assumption they're in three clusters. So we'll call them cluster A, cluster B, and cluster C. Just, and is this like a medical? Is this how they're actually defined in like
Yeah,
in medicine as well?
exactly.
Okay,
Yeah.
so let's talk about cluster A. What? How? Okay, so we have a question. Hella, it's only two of us tonight. It's just me and Jonathan. So you have to look at our pretty faces, and we don't have a third tonight. There was a third scheduled, but he had a prior commitment with work and couldn't make it. So now you just get us, and we're just as good, I promise. So let's talk about cluster A. Would you define cluster A in terms of personality disorders?
They are often considered like more bizarre or
Okay.
eccentric compared to other clusters. Yeah.
Okay.
So though the features of cluster A is more bizarre, like closer to psychotic disorders. They are not psychotic disorders, but they are more. They're closer to psychotic symptoms. Yeah.
Okay. So they're closer to psychotic symptoms. Okay. What are some of the? I have in my notes here three different types that are in cluster A. What are
Yeah.
they? I have.
So
Yeah. Go ahead.
So the first one is paranoid personality disorder,
Okay.
and then you can see right off the bat that it's closer to psychosis, right? Someone with
Yeah.
psychotic symptoms may be very paranoid or have what we call delusion. So in personality disorder, uh, the paranoid personality disorder doesn't have clear delusion. It's not as severe as a psychotic delusion, but the
Okay.
paranoid person will have a pattern of relationship in which the person is very resentful. She does not trust anybody.
Okay.
She expects that people will deceive her or him.
Yeah.
She has a constant doubt about his or her partner being cheating on her.
Okay.
They don't get close to people because they fear that they will be deceived. So this is again, like personality disorders. They are a pattern of relationships that normally are a pattern that is rigid and that affect the way they can be with other people. So the first one is paranoid personality disorder.
Okay.
The second one is schizoid
Okay.
personality disorder. So it sounds schizoid, it sounds like schizophrenia, but
Yeah.
it's not schizophrenia. Schizoid is people with schizoid personality disorder are people that um, they don't like relationship. They don't have close friends. They don't
Okay.
have sexual activities. They like to be alone. They often spend most of their time in their basement with the computer. They don't care about what other people think about
Okay.
them. They don't basically want to be in relation with other people.
Okay.
Um, uh, so that is schizoid personality disorder. The third one is schizotypal personality disorder, and those people are more they have bizarre beliefs. They can have bizarre way to talk to other people. They have few close friends. Most of their relations are superficial, and often people will look at them and think, oh, they are bizarre.
Okay.
Not bizarre as someone who's acutely psychotic or has schizophrenia, but they are outside of what is normally accepted in our society
Okay.
or in a culture, let's say. Yeah.
Okay. So that's like cluster A. And again, if anyone has any questions about any of these, we're happy to answer them. Just type them in the comments, and we'll get to them. Cluster B is the next one.
Yeah.
So what? How would you define how does cluster B differ from cluster A?
They are, if I said cluster A, they are more bizarre. Cluster B, they are not as bizarre as cluster A. It's more,
Okay.
they are often dramatic, or
Okay.
their main issues are affective issues. So their emotions,
Okay.
the way they deal with their emotions, or the way they interact with other people. So I would say cluster B has probably the most common personality disorders. So the one that we hear more often, like borderline personality disorder, which is
Okay.
probably the most studied one, the one that people know more, because they are often those we see in hospital, or that are affecting people's life more. Like if you're schizoid and you spend your life in your basement and you're happy and you work for a tech company, like you don't bother other people, so you can spend all your life being a schizoid personality and never seeing a psychologist or a psychiatrist. Cluster B, they often have more problems. So
Okay.
borderline is the one that we know the most. So basically, there are people with roller coaster emotions, very diffuse identity, meaning that they don't know who they are. They have issues with their self-confidence. They often have difficulty with anger management. They are impulsive. They have suicidal ideas. They often have depressive and anxiety symptoms as well. And the one key feature is that they fear being abandoned or rejected by other people. So
Okay.
I would say those are the biggest features of borderline personality.
Okay.
And I expect that most questions will be about borderline, because
Yeah,
this is the one
we have a lot of resources and stuff about borderline personality, about BPD, and just in general, we have we have Sylvia is one of our like resident local experts, I guess you could say, and she deals a lot with she offers workshops about BPD and
good.
validation and like a lot of different things. So that's something we're pretty familiar with in terms of hearing questions about. So I wouldn't be surprised if we get that. We do have one
Because
question.
yeah,
Yeah, it's
sorry,
just
go.
asking if it comes from their past traumas.
It's a very good questions.
Yeah.
We know that it's the biggest risk factor for borderline personality disorder is having had a traumatic experience when the person was a child. Or I would say that the biggest risk factor is genetic. If your parents have the same personality disorder, you're much more likely to have it. But then I would say we know that close to 70% of borderline personality disorder patients had traumatic experiences, and
Okay.
often it's sexual abuse. This is the one that we see a lot, but it could be other type of neglectful experiences, or other forms of abuse.
Okay.
So not all borderline patients had these traumatic experience,
Yeah.
but clearly most of them had this traumatic past experiences.
Okay. So I have another question here about cluster B specifically, which I think is pretty good. Is are cluster B able to address their issues? And so yeah, let's start with that. Here, I'm gonna put
That
the question up top here. There we go.
that's a very good question. So we have this medical term like egocentric or egodystonic
Okay.
that we use in psychiatry, and the egocentric is when you suffer from your symptoms. If you're
Okay.
depressed, sorry, egodystonic, when you if you're depressed or anxious, you don't like the way you feel, you don't like your anxiety, so it's egodystonic. Egocentric is that you don't suffer from it, and often we think of personality disorders as egocentric. So it's other people around that they have difficulty dealing with the person's symptoms, not
Okay.
the patient himself or herself. However, many borderline patients suffer from their symptoms. They come to the emergency often, and they are, to answer the question, they are able to address their issues.
Okay.
Um, there are different people, there are
Yeah.
different phases of the disease, so there's not a single answer.
Yeah.
But I would say that some people do very well in therapy,
Okay.
um, uh, and they can address their issues with the appropriate help.
Okay. I know I have another. I have two more questions coming in, but I have a quick question here. It kind of stuck out to me when you describe schizotypal as someone who is like they stay in their basements. They don't have personal relationships with people, and they just want to.
Schizoid, not
Oh,
schizotypal,
sorry,
schizoid.
schizoid. Yeah, schizoid.
Yeah,
Sorry, and they don't want to be around people, and they just kind of want to do their own thing. And so,
yeah.
what's the difference between that and antisocial personality disorder?
Oh, that's very different.
Okay, yeah, let's talk about
That's
that.
a good question. So antisocial is another
Yeah, it's
cluster
in
B
cluster B
personality
one.
disorder.
Yeah.
So antisocial, it's not that they don't want to be in relation with other people, it's that they are in relation with other people and they abuse them. They have no respect for other people. They don't care about others' feeling.
Oh, okay.
They don't care about the law. They are the ones deceiving other people, manipulating other people, and they have a lack of remorse. They are We don't use the term psychopath in psychiatry.
Yeah.
It's not a diagnosis, but they are the when you think of a psychopath,
Yeah.
Hannibal Lecter
Yeah.
or
Okay.
those
Like
psychopaths,
the
they are
more
antisocial. Like
characterized.
they
Okay.
are sharks. You can see them. They can be very high functioning. They are people like they are big corporate lawyers or big
Okay.
corporate businessmen, and they can function and manipulate and abuse a lot of people and be very successful in life. So, but those people who have no respect for other people, they have no empathy
Yeah.
for other people. They are
Okay.
antisocial. So it's not like schizoid. They don't like being with other people. Antisocial. They just um, manipulate other
Okay.
people for their own personal needs.
Gotcha. Okay. So I'm gonna bring in some of these questions now because we've got a lot of them rolling in here. So this one it's a bit long and it may or may not be relevant, but I think it can be. I think you could answer it a bit here. So I'm gonna hold it over the top here, put it over our heads, and it
Yeah.
says, "I'd like to know that whenever my adult son plays his video games, he becomes very angry and upset to a point that he
I don't
yells."
have the same. Sorry, I don't read the same question.
Oh yeah,
Did
you
you
don't
put
see
the
this
same?
one? Can you see it now or no?
I am not sure if this is relative to personality,
Yeah.
but
Oh,
I
I
would like
started a
to.
little bit later.
Oh, okay. Sorry,
Yeah.
sorry, sorry. I was
Yeah, it's
reading and
okay.
listening. Okay, sorry.
Yeah.
Okay, go ahead.
So
Sorry.
I'm gonna put it back at the top here just so we can kind of see
Yeah.
our faces a little. So, oh whoa, I don't know what happened there. All right. So her adult son plays his video games. He becomes very angry and upset to a point where he yells with anger. And once he broke the armchair out of anger, he says he enjoys the games, but it seems that he loses control of his anger. And overall, he's a nice, very educated, knowledgeable, calm, reasonable, caring, and perfectionist. And he comes from a loving and caring family and has a loving and caring girlfriend. And so, how would you like? It's hard, right? Because questions like this, I don't want to try and give someone a diagnosis. I don't think that's not what
Yeah.
we're here to do. But how does this play into different personality disorders, if at all?
One thing to keep in mind about personality disorders is that, as I said at the very beginning, it's a rigid pattern that most of the time it applies in all their areas of their life.
Okay. Okay.
It's not specific to their relationship with their girlfriend or boyfriend. It's not
Okay.
specific to their relationship at work. It's really a pattern of the way they are. So if you see someone having issues, like behavioral issues or emotional issues, only in one specific domain of their
Yeah.
life, this is not personality disorder.
Okay.
This may be other psychological problems.
Yeah.
It may affect them, it may affect other people. But when we're dealing with personality disorders, we're really dealing with something that affect all areas
Everything.
of their life.
So
Yeah,
it's like
exactly.
the bigger umbrella over it rather than just like my umbrella has a hole and it's dripping in this one spot.
Yeah, yeah,
I don't know if that's a good
yeah.
analogy, but that's what I'm going with. So here's another question from Alan. Can someone who gets a personality disorder from a trauma pass it on to their children even though they didn't get it from their parents?
Um, it's a good question. It's You don't pass it to your children.
Yeah.
Your children are more at risk of having it because you have it. The same
Okay.
way, if you suffer from depression most of your life, your children are at higher risk of having depression themselves. If you have schizophrenia, your children are at higher risk of having schizophrenia. Same thing with bipolar, same thing with
Yeah.
every mental illness.
Yeah.
Um, so it's not, it, we don't know, there's not one ingredient that you absolutely need to develop personality disorder or
Yeah.
for your children to develop personality disorder. There, we know that there are genetic factors. We know that having traumatic experiences as a child is a huge risk factor.
Yeah.
Being neglected by your parents is also a huge risk factor. So it's not that you pass it to your children, but definitely your children are at higher risk if
Yeah.
you have it. Yeah,
Yeah.
but then it doesn't mean that they will have it, depending if they have a very peaceful um, childhood and upbringing, and you are a supportive parent, a caring and loving parent. Even if you suffer from a personality disorder because yourself you had a traumatic experience, it doesn't mean that your child will have it. It's not
Yeah.
automatic, which
Yeah.
is nice because you can work with therapy and with your psychologist or psychiatrist, and then try to prevent the risk of your children to develop it.
Yeah, okay, and I have a couple comments coming in, and and I just wanted to say that like it's not, it's kind of just to reaffirm what you're saying. It's not just because your parents have it, you're gonna have it, and just because your parents didn't have it doesn't mean you're not gonna have it, right?
Yeah,
And this is like an important factor, and it's not nature versus nurture. It's not either. It can be. It's a combination of many different things. So that
yeah,
it's not as easy to simplify it and just be like, well, they grew up in a bad house and so therefore they're going to be mentally ill or they're going to have a mental illness in their life, because also
yeah,
resilience, people have different levels of resilience in their lives as well. And so
yeah.
two people can grow up in the same household and have very different reactions and in how they're manage their stress and anxiety in their lives.
Yeah.
So
Another analogy to better explain it is that, let's say if you go to war, we're both soldiers and we both face the same traumatic experiences.
yeah.
I may develop PTSD, post-traumatic stress disorder, and you may not, because of different factors, uh, despite being exposed to the same violence or traumatic experiences.
Yeah.
Yeah.
Okay. So let's see here. This is, I have one here from Antonio asking, how do you get your child to seek help? I want to just say right off the bat is talk to a doctor. That's the first step into speak a medical professional. I'd say that'd be the first step, is see what a doctor has to say about it, and don't
Yeah.
try to diagnose your child
Yeah.
on your own, because unless you're a
Yeah.
doctor, and even if you are a doctor,
Yeah.
doctors see doctors. Like
Yeah.
that's how
You're
it
right.
works. Like so that's what I would say. If Antonio, if you have questions, I'm gonna put our phone number up on the screen really quick. If you need help getting directions to like resources available to you, I lost my mouse on my screen. There it is. You can do that there. It's right here. You can call us 514-486-1448, and someone can answer the phone for you. Probably Connie is the one who's going to be answering the phone, and she can help you get to like good resources and stuff like that. But really, the best bet is to talk to a doctor. Unless you have anything else to add, that would really like that's what I would say.
I would say the only thing I would add is that if you are very, very concerned for your child's own safety or
Yeah.
for other people's safety, because let's say your child has very severe suicidal thoughts, or you read something, you went on the computer and saw that, I don't know, that your child was looking for different ways to kill himself or whatever.
Yeah.
If you are worried at that level, then don't wait to have a family doctor to do something. You can also bring your child to the emergency, or call 911, or
Exactly.
but in other circumstances, for something that are not as extreme, I agree with you.
Yeah.
Just talk to your doctor and about the problem.
Excellent. That's perfect. All right, so we got a bunch more questions here. Let's see here. Do patients with BPD know how to admit to their faults and take responsibility for their behaviors? Do they tend to play the game of shift blaming? That's a question.
It's a very good question. There are different people with borderline, and they can be at different stage as well. So
Okay.
what you identify is often something that people complain about their relatives or friends with
Yeah.
borderline personality. They blame other people. They don't take responsibility. They get themselves into a lot of fights with their friends, with their coworkers. So it's a common features that they tend to struggle with. Not all BPD patients, BPD being borderline personality disorder
Mm-hmm.
patients, have this problem. Most of them can improve with therapy, and this is really the purpose of therapy for borderline personality, is to help them understand the patterns they have of being into conflict with other people, or blaming other people, and getting into trouble. And so I can't say yes or no to that question,
Yeah.
but what you identified can be a common feature of
Yeah.
BPD. Yeah.
So one Sarah made a comment here saying, I would think it depends on whether or not they're in therapy and are trying to address their issues. If they're not in
Yeah.
counseling and are unaware of their behavior, then I would say that the answer is most likely no. So this is just what's going on in the comments here. I think that's a pretty good insight. Sarah
Yes.
actually had a good question here, and I think it's pretty interesting because it goes into a bit more of like a diagnosis. So personality disorders are just a way of categorizing people, though, right? There are no fixed criteria that is when used when diagnosing someone with these disorders. You're the
Uh,
doctor.
it's a tough question. We have clear criteria,
Yeah,
right? So for borderline personality disorders, they are, you have to get 5 symptoms out of, I don't remember by heart, I think it's 9 symptoms.
I think
Uh,
it's
so,
nine
so
as well. Yeah,
so we have a list of symptoms for each personality disorder, and then you have to meet a certain number of these criteria. So they are objective ways to diagnose someone
yeah,
with a personality disorder. So that is one. Second, two patients with a diagnosed personality disorder may have a different subset of criteria. So they may be very different, and they don't have the same symptoms or the same difficulties just because they have the same diagnosis. But because they, out of the 9 symptoms, the first person has 1, 2, 3, 4, 5, and the other one has 5, 6, 7, 8, 9.
yeah,
They both have the diagnosis, but they suffer from very different problems.
yeah,
And is it a way to categorize people? It, it's a common critique about psychiatry that it categorizes people, and it's true. We created categories um, to study mental disorders, and based on observations and seeing patients we've seen over the last hundreds of years, like a lot of people, let's say for depression, they suffer from, they have apathy, they have low energy, they are tired, they don't have energy, they have no interest in anything, they feel sad all the time. So based on thousands and thousands of people having the same problems, we categorize them as being depressed, and we created that label. There's no such thing as depression. Like it's a category that,
yeah,
and then we study it, and we try different treatments, psychotherapy, medication, to try helping those people. So it's, I would say it's the same thing with personality disorders. We make categories based on symptoms that people often present, and then we try helping them and studying our different treatment options to help them. So in a way, you're right. It's categories that we create, but it's based on symptoms that patients really suffer with. So that would be, I guess, my answer.
yeah. I think that's like yeah, that's a pretty pretty solid answer. I have another question here that was a little bit further up. I'm just trying to find it really quickly. It's again with BPD. Is it possible to outgrow borderline personality? disorder?
Good question.
Yeah.
The answer is definitely yes.
Okay.
Outgrow. I mean, you can. Most people, even without treatment, growing up, they won't meet the diagnostic criteria,
Okay.
and that is true for many personality disorders. That is true also for antisocial, for many cluster B personality disorders, I would say.
Okay.
Um, they don't get into much of what they learn from their mistakes, from their past difficulties. With therapy, we hope that we help that pathway. We accelerate the recovery, basically. But yes, people can stop meeting diagnostic criteria for borderline personality disorder with or without treatment, most likely with treatment, or much faster with treatment. Yeah. So
Okay.
it's a stable pattern of difficulties. This is what I said at the beginning. That's
Yeah.
a rigid pattern. So it's there for often since adolescence, since your teenage years, but you don't have the same severity as you grow up, as you get older, and often you don't meet enough criteria
Okay.
when you get into your 40s, 50s, 60s. Some people they remain very severe borderline until their 50s or 60s, but I would say most people that deal with very severe borderline personality disorder in their 20s, when they get in their 30s, they are much better. They function at a much
Okay.
higher level. They don't get into conflict as much as they did when they were younger. So people get better,
Okay.
definitely.
That's always.
I'm sorry, I know I gave long
No,
answers,
no, that's good. That's a
but it's
hopeful.
because
It's
you have very good questions, and
yeah.
I want to be also nuanced
Yeah.
in my answers. So often there are no clear right or
Yeah.
wrong or yes or no answers, but
Absolutely.
you
If
have
it
very
was
good
yes or
questions.
no, it'd be easy, right? And
Yeah,
that's
I
obviously when
wouldn't
we're
have
talking
a
about
job.
none of this stuff is easy. So I noticed that we do have a lot of questions coming in about BPD, and I'm
Yep.
just going to use this second, and I'm going to post a link here to our calendar. We have workshops on BPD regularly. They happen a few times a year. I highly encourage everyone to register for them. Keep an eye on our calendar when they come up. And earlier, I also posted a link to specifically our borderline personality disorder page, which has a lot of information about different ways that our signs, symptoms, and all of those things to look out for, just to kind of like help wrap your head around it a little bit. So I've got a bunch more questions here. So I'm trying to get through these. Here's another easy one for me to answer really quick. Can someone who is struggling and is not diagnosed call the number you gave us to be referred for someone they can talk to? Again, here's the number: 514-486-1448. I'm not sure that we can give you a referral to a specific doctor, but we can help you find resources and help you tell you like where to look for them, because we don't refer specific doctors. That's not what we do. It would be a severe conflict of interest, and that's just not where we're at. So yeah, we can help you find resources, but we don't tell you which doctor to go see, and that's definitely there. So yeah. Let's see here. I had another one that I saw a second ago. Um, Here we go. Julian is asking, is there any help for these people besides DBT, which is dialectical behavior therapy? Correct?
Yeah,
Yeah.
yeah.
And if the therapist refused to work with narcissistic and borderline personality disorder, then what hope would there be for, say, an 81-year-old mom to get rid of them and kick them out after years of abuse? Uh, how come Montreal does not have more intervention teams that step in? The narrative here should also be on the families on the receiving end of these disorders. Yeah, that's so.
It's
There's a lot going on in that question. So let's talk about it.
yes, and getting access to psychotherapy is very difficult in Quebec. We have a good health system, but it's free. But having access to it can be very challenging. It and most personality disorder programs, they have very strict criteria. If you don't meet the criteria, then it's unfortunate. They won't accept you, but they are overwhelmed by the demand.
Yeah.
So they have to be very specific to who they accept. And one reason for that is that they have group. A lot of these programs have group therapy, and DBT is often like a group therapy. So you have, in order to have a successful group, you have to get people with similar issues. If you don't meet criteria for a personality disorder program, then having a general psychiatrist can help. Having a psychologist, there are many forms of psychotherapy that can be helpful for personality disorders. DBT is one.
Mm-hmm.
There are others. DBT is probably, I would say, the most studied one. There are other forms of psychotherapy that can be helpful for borderline personality disorders, and a psychologist can do that. If you can afford going to private, there are almost no or less waiting time. If you have to go public, then you can ask at the CLSC. Depending where you live, it can be a couple of months to
Yeah.
sometimes up to a year before having access to a psychologist, and the number of sessions is limited. But there are resources. It's not perfect. I know we would like having more
Yeah.
groups, more personality disorder programs. But yeah,
Yeah.
this is
It's hard.
what I
Also, if you're
can say.
specifically speaking about someone who is a senior, I think you can talk to a lot of. There's a lot of groups that work with seniors and their rights and protecting seniors in Montreal. If you need
Yeah,
those resources, give us a call and we'll try to direct you to the right place. But
yeah,
that's probably where I would start if someone's in danger, even through
yeah.
their family member. That's definitely where I would
Because
start.
if an elderly suffer from elderly abuse because
Yeah.
of children with severe personality disorder, then definitely there's something to do, and it may be urgent. And if you don't get access, I mean, there's the therapy for the patient or the person creating the pain, but there's also issues that a social worker could help
Yeah.
at the CLSC, for instance, and that may be more urgent than the therapy for the person who has a personality disorder,
Yeah.
to protect the older person. Yeah.
Excellent. So I hear someone made a comment that you can't hear me. Can you hear me now? All my microphone levels say they're high, so hopefully everyone can still hear me. So I know that we could go down a really long road talking about the ways that the medical system lacks in covering psychiatric diagnoses and just in general. So I don't want to go too deep into that, and I want to try to stick to like the disorders themselves, because I'm seeing a lot of comments with frustrations, and I hear your frustrations, and I'm sorry that's not what we're going to talk about now. But I don't want to just like completely just like throw you aside. We call AMI-Quebec and we can try to direct you as best we can. But I hear you. I hear what you're saying. These frustrations are well known, and we do what we can to try to help people, and that's what we're here for. So yeah, I just wanted to make that like little caveat there. So let me scroll back up here. Here we go. This is a good one that Claudia asked earlier. Can someone be diagnosed with borderline personality disorder in their 40s? Yeah.
The short answer is yes and no. So this is not a short answer.
This is not a short
And,
answer.
okay, so long story short, you could be diagnosed in your 40s. However, to get diagnosed with personality disorder, any personality disorder, you have to have the difficulties or the symptoms when you were a teenager or a young adult. So it's possible that you get diagnosed in your
Oh,
40s
okay.
because you never reach for help, or nobody thought you needed help. You didn't see a psychologist or family doctor or psychiatrist. But if you had the symptoms when you were in your early 20s, you were never diagnosed, you could be diagnosed in your 40s.
Okay. So it's really about having a history of it.
Exactly,
Yeah.
exactly.
Okay. All right. So I turned my volume up to like max 130 volume, so hopefully that'll be a little bit better. Um, so let's see here. I had another really good one that I thought was gonna be relevant. Here's another one. What is it about DBT? This is dialectical behavior therapy that helps BPD, borderline personality disorder patients. So what is it about DBT that helps BPD patients?
Um, so one quick reason is that DBT was developed specifically for BPD. So this is a specific therapy, or a therapy that was specifically developed for BPD. And so that is one reason why it works. It's because it targets key symptoms of BPD. So,
Okay.
and the interventions, for instance, one of the key aspect of DBT is mindfulness, and it helps. It's been shown to help people to regulate their own emotions, which is often a huge challenge for people with BPD. And they also specifically target interpersonal difficulties, and they have group sessions about that. So really, the key is that it was developed specifically for borderline. So it works to help and improve their symptoms.
Yeah.
Yeah.
So I've seen a bunch of questions that have come up about this, and I'm going to answer this one. Sam, is there any therapy or counseling services that you can access online that is free? So first thing I'm going to say is call us 414-48. I don't even remember the number off the top of my head because I'm all blurred. Here it is. Give us a call and we can try to guide you. It's right. Yeah, it's over here. 514-486-1448. Give us a call and we can try to direct you. However, if you don't want to call us because you're like, you know what, those guys, they are really bad. I don't want to talk to them, but I'll listen to them on Facebook. Next, in 2 weeks, I am going to be back live with two of our staff members. We're going to be with Connie and with Natalie, and we're going to be talking about affordable mental health services, so that are available to anybody and everybody in Quebec. So we're going to be talking about apps. We're going to be talking about local services, online things. Anything is from free to affordable. So I just got to plug that. So you can tune in 2 weeks. Go to our Facebook page. It's an event. And you can, and I'll post in a link to the event at the end of all of this because I foolishly didn't save it in advance, and so I can't find it right now. So yeah, you can do that, and we'll try to like help you get knowledge about what's available out there that's accessible. And we'll be able to answer questions as best as we can there. And then finally, I just want to make sure that I push our support groups again. They are free. They happen 3 Mondays of every month, and we talk about all different kinds of things. One of the groups that would be very relevant for people here that are tuning in now is BPD for caregivers. That's one of them. We have ones about anxiety, depression, hoarding, kaleidoscope, which is for all diagnoses. It's all of them, and so we've got a lot of support groups that are 3 Mondays a month, and I encourage you to check those out because they are there and useful. All right, now questions. This is one kind of related to what you talked about a second ago. I'm behind on comments here, but we're gonna keep going with this. Do you need a diagnosis to receive therapy from a public resource?
Um, to get into a specific third line personality disorder program, yes, there's it they all start with an assessment,
Okay.
and then they'll see if you meet the criteria. So by definition, because of the assessment, before getting into the program, you'll have the diagnosis. Uh, However, you can go to the CLSC, or be referred to the CLSC by your family doctor or by anyone, and not having a diagnosis yet, and receive help from a social worker or a psychologist or a therapist from the CLSC,
Yeah.
even if you don't have a diagnosis.
All right. So
And you
this
may get the diagnosis later or not.
Yeah. So this is something. This is another question that we're. I'll put it on the screen, but I will say that in the future we will have, and it's part of our series, is treatments for mental illnesses, and which we'll be able to get into a lot more detail about this. But I think that we can definitely go a very quick summary of the differences between DBT and CBT if you feel up to it, Jonathan.
Yeah. I don't mind quickly answering.
Yeah.
Like DBT is a form of CBT basically, but it's again it specifically targets personality disorder. It includes other elements that are not commonly seen in CBT, like mindfulness, and also like other features. CBT can be used for, you have CBT for personality disorder, you have CBT for anxiety, you have CBT for depression, you have CBT for psychosis. And CBT basically it's a broad model that basically says that the way you think, the way you feel, and the way you behave are linked to each other. And if we work on the way you think, we may modify the way you
Okay.
feel. And that's the broad idea of
Yeah.
CBT. And DBT starts from there, but includes other elements to specifically target borderline personality.
Excellent. Excellent summation. All right, so I've got a lot of questions. You guys are really like on it today. So I'm gonna take a pause from the questions because I do want to make sure that we don't. We've got 15 minutes left, and we've been talking a lot about cluster B, but I want to make sure that we at least talk a little bit about cluster C. If we end up talking about cluster B again, that's fine. But I just want to make sure the whole point is to bring out all of these so that way everyone can know the differences and kind of like just get more information out there. So we've talked about cluster A, cluster B. So let's talk about cluster C.
Maybe you want me to just finish with cluster B quickly?
Oh yeah, there was
When we speak about the histrionic and narcissistic.
Yeah, let's talk about those two. Yeah.
Okay, so I'll be very quick because I want to answer as many questions as we can. But histrionic are really people who they are attention seeking. They want to be the center of attention all the time. They are superficial. Their emotions are superficial. They are seducer in the way they dress, in the way they behave. And they have like superficial emotions and relations. Narcissistic is very prevalent, and they are people who constantly needs to be admired. They have some sense of being grandiose, being better than other people. They often lack empathy. They believe that people they owe them everything. They can be arrogant, and they often use other people. So they are. Let's say we were talking about antisocial. So if you have antisocial and narcissistic, then you're more likely to become close to a psychopath. That ends the cluster B. Cluster C, you have three different disorders. You have avoidant. Avoidant is very similar to social anxiety. It's almost the same thing. So when you are avoidant, you're very fearful of interpersonal relations. You are very shy. You don't get involved in activities unless you're sure you will be accepted. You're risk avoidant. You always fear of being rejected by other people. So at the end, it's different from being schizoid. Schizoid, you just don't want to be with other people. Avoidant, you don't get with other people, but it's because you're afraid of and you lack self-confidence, basically. That's a shortcut, but I would summarize avoidant like this. So it's the way it's different from schizoid. Then you have dependent personality. So those are people who always need to rely on other people. They can't make a decision. They can't commit to anything. They always need to be with other people. and they get very, very anxious when they are alone and nobody is taking care of them. And the last one is OCPD, obsessive compulsive personality disorder. It's different from OCD,
Okay.
obsessive compulsive disorder. Again, it's a broader general uh, pattern that you are rigid, you are obsessional with details. It's your way or the highway.
Okay.
Um, you don't let other people do the work because you think you're the only one who can do the work properly. There's one way to cook, there's one way to clean, there's one way
Oh,
to,
okay.
and it has to be like that. It's not OCD like you
Yeah.
have to wash your hands like 30 times
Yeah.
an hour. It's more that you are rigid. There's only one way to do something. Um, and you are very detail oriented. So
That's
that is cluster C. So those are more anxious personality disorders,
okay.
or what we call neurotic personality disorders.
Okay.
Uh,
It's interesting because I never even knew that OCPD was different, and
yeah.
that's neat that you clarified that.
Yeah.
So we got another question here. All right, I'm just gonna jump to the bottom. If I didn't get to your question, maybe ask it again. It's hard to shuffle through all of these. But I will answer this one. Sam, this is saying you'll receive an email letting you know the date and time that live video will be affordable therapy in Quebec. So the Affordable Mental Health Services, Mark posted a link to the event up there. If you say you're going to attend the event on Facebook, you will get a notification saying we went live, and it will be Thursday the 26th at Thursday the 25th, sorry, at 7 p.m. So you can put it on your calendar right now. I will be there with my beautiful face. Jonathan won't be there, but I will have two staff members from AMI-Quebec, and we will be there to answer as many questions as we can in an hour. So let's talk about this question here from Allison. Woo! We're on a roll. So, as caregivers and family, what pointers can you give us when we're talking to a BPD patient? So, a borderline personality disorder patient.
Um, I guess it depends how
Yeah.
much you have issues or it's challenging. I would say uh, probably the best advice is to support them, try to be there, stable, try to contain when they have emotional outburst, try to be supportive, caring, despite sometimes that it can be very challenging.
Yeah.
That's part of the illness, that's part of the disorder, having roller coaster emotions, having unstable relational patterns. If you're there, you're reliable, you remain caring and loving for them. That's probably the best thing you can do. And then,
Another.
then encourage them getting psychotherapy.
Yeah.
Yeah.
One more thing too that you can do is we have a workshop for BPD validation, which is a way that you can kind of validate someone's experiences without necessarily approving of them. You don't have to acknowledge. It's just acknowledging that their experiences and that it's difficult and whatever it is that they're going through is valid, but that it still has effects and consequences and all of that stuff. And so that's a workshop that Sylvie throws. It's not a party. Sylvie puts that workshop on with
Because
Emmy Quebec.
there are so many layers that I could answer that question for an hour,
Yeah, I mean, we can have we have had whole
yeah.
workshops just on that question, and is on how to support
So
BPD family members.
if I can add one thing that may be very helpful is try to identify situations in which things are at risk to escalate, and try to avoid behaving in a way that will just throw oil on the fire.
Yeah.
And sometimes to step back and wait for the storm to go away
Yeah.
might be a very good strategy when you're dealing with someone with BPD and who's in crisis.
Yeah. So this is a good question about OPCD, which is we talked about earlier, which is obsessive compulsive personality disorder, so it's just switched up a little bit. Is it close to the autism spectrum?
Um, Probably closer than other personality disorder. I would say autism also is somewhat close to schizoid.
Okay.
Uh, Autism has many features, one of which is rigidity. So I understand where you come from with this question. But there are many other features in autism that you don't see in OCPD. Really,
Okay.
OCPD is being rigid, having high standards. It's there's one way to do things, so they get into conflicts with colleagues at work because they don't work well in team. So you have rigidity in autism, but you have a lot of other issues with autism that you don't have in OCPD.
Yeah. Excellent. Um, Oof, here we go. Another one. Despite them being symptoms of BPD, can you have. Whoa. Despite them being symptoms of borderline personality disorder, can you have borderline personality disorder, depression, and anxiety as comorbid disorders? And if so, how do you get help for each issue separately?
Okay,
Yeah.
there are different answers. They are not criteria of BPD.
Okay.
Depression and anxiety, they are often seen in people who have BPD because they have roller coaster emotions, they have unstable identity, so they often suffer from depression and anxiety.
Okay.
However, and they have comorbid anxiety and depressive disorders often as well. So you don't get help separately for that. You try
Yeah.
ideally to get help as a whole. We don't treat a disease, we treat a person.
Yeah.
And I would say most health providers would believe that you can get medication for anxiety and depression if you really have an anxiety disorders like generalized anxiety disorder or major depression episode. Um, but ideally, you get a treatment for all your symptoms together. And if you need help specifically for depressive symptoms because you have a major depressive episode, then you can, like your psychotherapy can focus on your depressive symptoms for a couple of weeks.
Yeah.
And then if it gets better, then it can shift back to your other issues with BPD. Yeah.
Yeah, I think taking a more holistic approach of the person. You're not, like you said, I think that's great, where doctors are treating the person, not the diagnosis. Because also,
But sometimes you need specific help for a
to
specific
focus.
problem, and you
Yeah.
may have more than one problems. Ideally, you have a doctor that can treat all of these problems
Yeah.
together, and yeah.
That's why it's important to find a good doctor. All doctors are good. No, that's not true at all. Sorry.
I won't answer that.
Yeah. You don't have to. It's okay. So we've got about 3 minutes left. Does anyone have any? If anyone's got any like last minute questions, I just want to say Jean here is saying that the courses really help. So yeah, I'm gonna push it again. I push it all the time. It's really like there's so much information there that we cover in our workshops. If you're never ever not sure, you can always check them out on our calendar, which I am posting the link to right now. We have a new calendar coming out for April, and we are doing a lot of good stuff for April, May, and June. So just make sure you keep an eye out on that page. It should be coming out in the next week or so, because April's almost here. But we've got a lot of good workshops coming up, and we're gonna have. Just to kind of also to kind of like push what's going on Facebook. I'm gonna take this time now. We have been doing once a month. We've been doing a Facebook Live specifically about a mental health topic, and then every once in a while we'll have some of the doctors come in and they'll talk about the hot topics or they'll talk about specific mental illnesses. Well, we're ramping it up, and every 2 weeks, starting in April, I'm going to be live and we're going to be talking about something. So every other Thursday, you get to see this pretty face. Maybe I'll trim my beard a little bit. Maybe, brush my hair and try and look a little bit nicer. But I'll be here a lot more regularly, just for you to ask questions and to try to get as much information out there into the world as possible. And so you can just tune in. I didn't see any more questions come in. Um, oh, here's the one. Okay, so let's talk about. Okay, I got two more questions and then we're done. So I don't know if this is a generalized question, and I don't know if this is. Anyways, we'll see what we have to say. So some therapists may not want to work with patients with BPD or narcissistic personality disorder. Why might they? Why might that be the situation?
I I don't know. I would. I'm not sure I understand the question. If you have both, then a therapist wouldn't want to work with a patient who has both BPD and narcissistic. That may be possible if the group they have is specifically for BPD and the person suffer more from narcissistic and
Okay.
it disrupts the group. That could be an issue. But I would say if you have a psychiatrist or a psychologist, they will try to deal with the patient's issues altogether again. And if they have, often I presented also the personality disorders as separate or different entities, but often you may have features of different personality disorders. I may look at them and find some of features that I have myself, and we may do that, all of us. But someone with a clear personality disorder may not only be a pure borderline, but may have some antisocial traits, some narcissistic traits, some avoidant traits. So I would say most therapists would accept trying to help the people no matter what traits they have.
And if you're having a hard time finding a therapist, keep looking. That also could be it. It's just that maybe it wasn't a good fit, and that just happens sometimes. It just certain doctors are just not a good fit. Certain therapists aren't a good fit, and it just doesn't work well. I have one more question, and then we're gonna say goodnight. If you have BPD, does pregnancy and afterbirth affect it?
How I'm not sure I
So
understand the question. If it
let's see.
affects the BPD,
Yeah, if it affects the BPD, yeah. So, like, does being pregnant either could it make BPD worse? Could it make it easier? Does it make more symptoms come out? Is there any kind of correlation between pregnancy and BPD symptoms?
that's a very difficult question. It's a good question. Not sure I have a good answer. I would say that pregnancy is a stressful situation for sure. It brings a lot of physiological changes. Even women with no personality disorder may have a lot of emotional dysregulation during the pregnancy, may cry a lot, may have more impulsive behavior. Sometimes you see they eat a lot and they binge eat, or so you may have a lot of difficulties to adjust to the pregnancy itself, no matter if you have BPD. If you have difficulty dealing with stressful situations because you have BPD, it's possible that being pregnant makes things worse. However, I wouldn't say that pregnancy worsen BPD, period.
Yeah.
I would say that it may get difficult, it may be a challenge, but it may go very well. It may also bring some stability because you are off work, or if you are on the maternity leave and you can take time with your child and everything is going well, it may bring some stability. So there's no yes or no answer, but I would say it can be a challenge for some women for sure.
All right. Well, thank you everybody for tuning in. That was like a firestorm, like a whirlwind of questions there. It was really good. I love when you guys have questions and the interaction. It makes us a lot more interesting and dynamic, and not just me and Jonathan standing here going blah 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 blah, sounding like the Charlie Brown people. Jonathan, thank you so much for attending. Do you have any like parting words?
No, it was my pleasure being here. I really appreciate your questions. You really had good questions, and I hope I did help or provide some answers to some of your questions. But thank you again. It was very pleasant for me.
Yeah. Thank you again, Jonathan. Every time I have one of the residents on, it's always a good time. You guys are all so incredibly smart and like thoughtful, and just like it's good to see, and it's encouraging to see the young doctors coming up and coming out into the world right now that are just like they're breaking that cycle. I feel like of like the doctors feeling like they just like know everything and they have the answers and that's all. And I feel like that was a common misconception in the past, that hopefully that's like changing now, and doctors are a lot more open to working with people as patients and not necessarily as just like numbers per se. And I get that from all of the residents that we work with, which is awesome and very heartwarming.
Good.
Thank you everyone for tuning in. I posted a link to a feedback survey that we put out. If you could give us some feedback, it really helps us make sure that everything is going smooth, what we can change, what we need to change, what works, what doesn't work. Yeah, everything is flexible, right? I take your feedback and I try to put it into the next episode. So thank you everyone, and Jonathan, again, thank you so much, and good night everybody.
Bye.